It is Breast Cancer Awareness Month, and for many new patients, they may wonder how much breast tissue they can actually save, and that's where folks like Dave Quinn come in here at Lake Charles Memorial Hospital in the Oncology Center. And you're a medical physicist, which is something I'd never heard of before. What is it that you do here?
My primary role is to ensure the overall quality of the treatments, the calibration of the equipment, the proper performance of all the moving parts, and just kind of a quality manager of the whole process.
And I understand over time that treatment just keeps getting better and better and better for cancer patients. And one thing that is better now than it has ever been is the way you actually target a tumor and treat a tumor.
No question. The strides we've made as far as imaging, targeting, reducing doses to critical structures. We've always been able to deliver a curative dose, but the advances have really been made in reducing the doses to the critical structures.
And that helps preserve all the tissue around that may still be healthy tissue.
Absolutely.
All right, and that's really the goal of any treatment, is to keep as much as you can and just get rid of the stuff that you want to get rid of.
That's correct.
All right, you've got some new treatments that are relatively new that you're using here at the hospital now. What is it and how does it work? Very
excited about a Savvy application that we're currently undertaking. Traditionally, the radiation would come externally from a machine, and now we're going directly into the tumor cavity, inserting an applicator, expanding that applicator with some catheters, and feeding a radioactive source through each catheter, customizing the time that source spends at each position in order to shape the dose and, as we mentioned, reduce doses to critical structures.
Okay, and it's really amazing how you can target tumors now, and even if someone is getting treatment and they're breathing and those things inside your body are moving, it doesn't matter so much because you can follow the tumor?
Absolutely, that's a fourth dimension. Everything's been 3D up until this time. Now you introduce the time management, the motion management. We're using things such as breath hold techniques, image guided, gating, coordinating the radiation with the patient's breathing, all in hopes of reducing the dose to the critical structures.
And those new advances just keep on coming for all types of cancer patients.
Yes, ma'am.
All right, and we're talking specifically about breast cancer patients this month. A lot of advances there, and women are seeing better outcomes all the time.
Absolutely. We've always done a good job, as I said, treating the intact breast, but we've done things such as reducing exposure to the heart, to the lung underneath, the contralateral breast, and the patient outcomes have been outstanding.
All right, it really is remarkable the changes that have happened in just a few short years, and you can find out more by calling Lake Charles Memorial Hospital and speaking to the oncology department. Thanks for talking to us.
Thank you. Thanks for having us.